Lipoid pneumonia is described as a prolonged suction of oil into the lungs and is associated with e-cigarette use in case reports. A study on similarities between clinical cases and define a new class of lung diseases, namely exogenous lipoid pneumonia and chemical pneumonia, and define the role of the use of electronic cigarettes in the development of these diseases. Although lung diseases associated with steaming products have so far been classified as a diagnosis of exclusion and described at best as exogenous lipoid pneumonia or chemical pneumonia, the number of lung injuries associated with the use of products has increased significantly. Here we describe the first study of an otherwise healthy patient who used cannabis, with electronic cigarettes. Propylene glycol, propane, glycerol and their byproducts e.g. propene and propanol are thought to produce lipoid pneumonia in response to inhalation of oil and/or nicotine vapor. The link between lipoid pneumonia and vaping was realized when researchers discovered that lipids develop in the lungs of patients with chronic obstructive pulmonary disease, probably due to the harsh chemicals found in steaming liquids. The researchers found an increased risk in patients who developed diffuse alveolar hemorrhage and organized pneumonia due to the evaporation risk of lipoid pneumonia. A higher risk of spreading alvesolar damage, a common cause of pneumonia in COPD, has also been identified as a possible risk associated with vaporization. These fat-laden macrophages are extremely unusual and have a distinctive appearance, said lead author Dr. David L. Lipscomb of the University of California, San Diego, in a press release. Lipoid pneumonia is characterized by a high number of cases of exogenous lipoid pneumonia, which is reported to occur in hospitals as a vape-related lung disease. In particular, it is also used to diagnose chemical pneumonia, a lung disease caused by the inhalation of fatty particles, and other lung diseases. In an email to Rolling Stone, Aberg said that obese pneumonia can also be caused by accidental inhalation of fluid into the lungs, such as when taking an oil-based laxative. Lipoid pneumonia has been reported as a result of inhalation of laxative-based oils, but it is also common in rare respiratory diseases that occur in May, June, July, August, September, October, November and December. There are respiratory illnesses in the US and later in Spain which suggest that this is a direct result of evaporation. However, there is no evidence that vaporization exposes people to lipoid pneumonia, as the vaporization of commercially available e-liquids does not contain any fatty material. A North Carolina team reported that it had diagnosed fumes in 5 patients, related illnesses, all with fat-soluble pneumonia, and speculated that the cause might be the aerosolic oil from e-cigarettes that these patients inhaled. After a thorough review of the clinical cases, no evidence of a direct link between the inhalation of the oil and the formation of lipoids in the lungs could be found. What they did not find was an indication that lipoidal pneumonia occurs when the fat enters the lungs. Interestingly, propylene glycol, vegetable glycerol, is the vehicle for nicotine delivery and can alter the respiratory tract abnormally. In particular, there are no reports of lung injury in those who vaporize only nicotine and no evidence of respiratory disease. There is evidence that aerosol oil inhaled from e-cigarettes can build up in the lungs by depositing itself in the distal airway alveoli, triggering a local inflammatory reaction that impairs vital gas exchange. This mechanism was used to explain amiodarone, an induced lung injury. ARDS and pulmonary embolism (PE) are potentially life-threatening diseases, with the CAP considered a possible intervention. Organized pneumonia and diffuse interstitial lung disease (ILD), which affects more than 1.5 million people in the U.S., has been reported in some e-cigarette users.